2024, and welcome to the May edition of Whitney's Healthcheck. I'm Whitney Sanjari, the Community Health Educator at Tomah Memorial Hospital, and this month I'm joined by physical therapist Emily Wall from the Hospital Rehab Service Department. Emily and I are covering balance and vertigo issues that most people don't realize can be treated and how Tomah Memorial Hospital can help. All right, thanks so much for joining us today, Emily.
Yeah.
All right, so you are a vestibular expert at the hospital.
I try to be, yeah, on most days.
What does that mean? What is vestibular mean?
What is vestibular? So vestibular, your vestibular system is in your inner ear. It is these little canals housed inside the inner ear. And what there is there's fluid in those canals, and what happens is when you turn your head and you move, those canals have that fluid and it moves, and it helps your brain interpret where you are in space, and so it helps you balance and stay upright.
Okay, so the fluid within that little canal is what, when I move, the fluid moves, and that's how my brain knows where I'm at.
That's, along with like your eyes help you balance, and then your feet and your knees and things like that help you balance. So all those things help your body stay balanced.
So that's when things are going well, when that's how it's supposed to work. Okay,
everything's
so
in sync.
I have heard about something like crystals breaking off or something. What is that?
So there are crystals that are housed in one portion of this organ.
Okay, so in the inner ear.
In the inner ear, but sometimes they get kind of loose for whatever reason it is, and they will migrate up into those semicircular canals in your ear. Okay. And you will develop something called benign paroxysmal positional vertigo, and that's a huge word. We shorten it up and we call it BPPV. Okay.
That doesn't seem much shorter.
That doesn't seem much shorter.
Okay, so, BPPV.
Yeah,
okay.
And so it is a vertigo, which means room spinning. Thing that happens when you change positions. So when a person is still, typically they won't have this kind of vertigo because the crystals won't move. But when you move around, the crystals with the fluid will move around, and that will cause a person to become dizzy, and they will get off balance.
So we're like right here in the ear, like in these little half things.
Those little
So you brought a visual.
I did bring a visual.
Works.
Okay, so I don't know if they can see this.
Okay, but imagine if you're with me here, audience. She's got little itty bitty balls in here that symbolize the crystals.
Yeah, they're the crystals.
Right?
So I'm sitting still.
Okay.
So I'm sitting still. And then I move and swoosh.
So the crystals are not supposed to be in there though, right now?
They're not supposed to be in there. And so what we do is when we evaluate a person, we try to determine which canal those crystals are in, because it matters, depending on which canal they're in, what we do for treatment. Okay,
so there are like three of them? Is that what they're? Okay,
there's
so
three on the left, and then there's three on the right as well.
Okay, so how do you get, I'm not just gonna reach in my ear and put these crystals back. So how do you help that? What do you do to treat that? So
we basically have to kind of move the person through a series of movements and try to put the crystals back where they're supposed to go. Okay,
and then how do you determine though which little like half circle it's in?
They're in. Okay, so what I do is I use here, I'm gonna kind of have to unlock my computer, sorry about this.
So while you're doing that, I will put this on. This is a tool that you brought that you use.
So this is my tool that I use, and these are called Frenzel goggles. And they actually have, we taped Whitney before, they have an infrared camera inside of them. This is a good look for you, Whitney.
I know, right?
Yeah.
So they have virtual reality.
Infrared cameras in each side, and so I can see your right and your left eye. And so I take people through a series of tests, putting them in different positions, and I see how their eyes respond to being changed in positions.
So you would be able to tell what vertigo issue I'm having by how my eyes react to when you move me?
Yep, I would be able to tell. Yep.
Okay. And can you see my eyes are on the screen? Is it there?
We can see. We have them already taped. Yep. So you have it on the screen here, and your eyes are actually really nice, and they're nice and still, and they're not moving around.
But if I was having, I'm gonna take these off now. So if I was having problems with vertigo, what would happen to my eyes?
So your eyes would do something called nystagmus, and that is kind of a funny word.
Break that down.
So a nystagmus is a rhythmical beat of the eye. Okay, and it typically goes in one direction. And so we would name what way that nystagmus moves.
So they'd be like pulsing, kind of.
They would be pulsing, and they always do the same thing. The right and the left eye should be doing the same thing.
So you would be able to tell based on looking at my eye how to fix it.
How to fix it.
Okay, so the different therapy options then, you would use the camera to then decide if you needed to like put me in different positions. Is that how that works?
Yep. Yeah.
Okay, all right. That kind of makes a little bit of sense. We simplified it a little bit.
Yeah, we did. But that I think that hopefully gives the viewers a kind of an idea of what we do in vestibular therapy.
Okay, so these services, then you do this at Tomah Memorial Hospital?
Do. And there are 2 other therapists that do this alongside me. Yep.
So who would this therapy be good for? How would you know if you might be a good candidate for this?
Well, a lot of times what people will have with this type of vertigo is they will wake up in the morning and they will just have this like sudden onset of vertigo. Now,
meaning like dizziness,
yep, and it'll come on. Now, here's the thing that's kind of the kicker here is that lots of things cause people to have an onset of vertigo or dizziness. So we don't want to just say, oh, it's this kind of vertigo and it's nothing else, because it could be something much more serious.
But the camera will help you determine?
The camera will help me determine. Typically, people will go to their physician first,
okay,
and they will rule out the really bad things that could be causing them to be dizzy.
Okay.
And then once they've ruled that out, then they come and see us.
Okay. All right. Wonderful.
Yeah.
Well, thank you so much, Emily, for joining us. Don't forget that you can find this and past editions of Whitney's Health Check on the Links 24 Facebook page. When we come back, Nick and April will be drawing for the winner of the Armed Forces Day VIP tickets. Don't go anywhere.
Thanks, Whitney.
All right. Yes.